Good morning, viewers. My name is Dr. Joseph Onigbinde, or Brother Joe. I am a dental surgeon, a public health advocate, an infectious disease specialist. But this morning I want us to look at a crucial subject that affects almost everybody. That is in dental surgery, and it's about halitosis. I'm sure many of you have heard about halitosis before, or don't know the meaning of halitosis. Halitosis simply means fetal oris, that's another plants, or bad breath. You agree with me that bad breath affects almost everybody, both small and old. So I want us to look at this very important topic, and it has affected so many people psychologically that they can hardly live a normal life. This morning we are going to talk about the causes of halitosis and how you can prevent halitosis and some other causes that you may not even think about. This morning, like I said, halitosis means fetal oris or bad breath, and it affects everybody. And there are intraoral causes, that means that emanate from the mouth, from the buccal cavity from the mouth, or extraoral causes. Because it's not, sometimes you might take care of your oral health. You brush 2 times, 3 times, 4 times a day. Despite all that, you still have bad breath. It could be as a result of extraoral causes. Now let us start with intraoral causes, which is the commonest cause of halitosis. Intraoral causes could be, maybe you have holes in your teeth that we call dental caries, where you have carious cavity in your mouth, food particles and other debris will pack inside it and then act on those food particles and degrade them and produce substances that will produce foul breath. So if you have holes in your teeth, it is time you went to the doctor to fill it for you so that you don't have foul breath. Another thing, gums can also give you problems. That's gums diseases that you can have maybe due to a poor brushing technique, or sometimes when people are pregnant, you have pregnancy gingivitis, pregnancy periodontitis, that also can give you halitosis. Then other diseases of the tongue, diseases of the cheeks, oral mucosa, ulcers, for instance, in the mouth, can also give you halitosis. Well, I think we'll come back to that later. Let's talk about extraoral halitosis. Extraoral, that's halitosis that is due to extraoral roots. For instance, if you have problem with your nasal cavity, with the nasal sinuses, paranasal sinuses, like you have a sinusitis, you always have a catarrh in your nose. The tendency you also have poor foul breath, because they are all connected. The mouth and the nose and the ears, these are holes that they are connected. So when you have problems with your nose, with your paranasal sinuses, we have some cave-like structures in the face. I call nasal sinuses, paranasal sinuses. If you have infection of that place, you can also have halitosis. Then we also have some diseases, systemic diseases that will show themselves as bad breath. For instance, diabetes, especially when it generates ketones, body being formed, ketoacidosis and all that, it will manifest in the mouth as a bad breath. So you will see that it's not only just taking care of your mouth that matters, and other causes too that can give you halitosis. Any problem along the gastrointestinal tract, that is from your throat down to your intestine, can give you halitosis. For instance, if you have ulcers along these pharynxes and even in your stomach, gastric ulcers or cancers, or it can also give you halitosis. And another very strong cause of halitosis is if you have colon, that has problem in your colon, and then all the food particle being pushed to that place can convert to something that is very that to produce bad breath. And then sometimes when you also have liver diseases, liver disease can also give halitosis.
All right, doctor, can you tell us the difference between halitosis, pseudohalitosis, and halitophobia?
Okay, thank you. That's a very good question. Halitosis, I've told you, simply means bad breath, or it's also called fetal oris. For sure, it's there. When you are talking, people tend to move away or try to cover their noses and all that. That's halitosis. The pseudo-halitosis is like pseudo. When you say pseudo, it's fake. It's pseudo-halitosis is fake. The person does not actually have halitosis, but feels that he or she has halitosis, called that pseudo-halitosis, and it's a psychological problem. I've seen a lot of patients like that. They say, doctor, see, when I'm talking, people move away. When I do see the guns, and can't you perceive it? I can't perceive any odor. But mentally, it is registered with her that she has halitosis. That is pseudo-halitosis. Halitophobia is also psychological. That's the fear that my mouth is smelling, or when I'm talking to this person now, this person will cover his or her mouth. So most of the time when they will talk without confidence, sometimes we try to cover their mouth and say, that's somebody who has halitophobia. That is fear of halitosis. There's some chewing gum that are actually good to stimulate your glands to produce more. And the example is xylitol. Xylitol chewing gum is sugarless chewing gum. In fact, the sugar there even promotes health, promotes the oral health rather than damaging your teeth. So you can get xylitol and just chew it 1, 2, or 3 times in a day. It's not because you want to spoil your teeth, but actually so that you can stimulate the formation of these cells that give you saliva, keeps your mouth clean. It is very good to keep optimum oral health, because the mouth is the gateway of the body. So in order to maintain good general health that is good, we advise that you visit your dentist, adults at least 2 times in a year, while children are advised to see the dentist at least 3 or 4 times every year, so as to check up and then clean up if necessary, and they give all other tips that are necessary. Very important. Thank you very much. If you have more questions and you need more explanations or elucidation, you can contact me through my Gmail. That's Onigbinde07, Onigbinde07 @gmail.com. Or you can also call me on 080 371 30396, 080 371 30396. Thank you. Yeah, I hope you enjoyed the short lecture we had this morning. Don't forget to subscribe, like, and share this video with your friends and all other well-wishers. Until we meet next Friday, I still remain Dr. Joe Onigbinde. God bless you. Thank you.